Hello, I'm Dr. Pierre Samaan from New Horizons Institute of Counseling. I'm a clinical pastoral counselor, and it's wonderful to be with you again as we continue in the series about anxiety. And in the previous program, I was talking about teen and adult anxiety, and we're finishing it off here with a few more things. I was talking about risk factors, and risk factors in anxiety just kind of help us to be more aware of what to watch out for or what could bring about a greater risk to either contribute to it, make it stronger, make it more powerful, or kick it in, when it never occurred before. And we left off with temperamental traits, so temperaments, and I spoke about the different temperaments and how each temperament can have a proclivity towards certain symptoms if not controlled. Exposure to stressful and negative life or environmental events, we spoke about that a little earlier. Those things can be a factor, a risk factor. History of anxiety or other mental illnesses in biological relatives. So we talked earlier about the importance of the genetics or the physiology and going back, finding out history, and that helps identify risk factors. Some physical health conditions such as thyroid problem. Many times someone comes in dealing with anxiety symptoms, and I encourage them to see their doctor for medical exam, for an assessment, rule out anything medical that could be occurring, and wouldn't you know it, they find out it's a thyroid problem, and just taking the medicine for it, and thyroid settles down and those symptoms go away. Heart arrhythmias, pounding or speeding up or skipping beats, certainly that's a factor of risk, a sign that either there's anxiety or it could be medical. Again, identify what it is, find out what it is. Why worry over things that you don't know? Identify it, get it taken care of. Oh boy, caffeine, especially nowadays with these drinks that speed you up. I drank one once and I felt nauseous, and I thought, oh, I'm never going to do that again. It's going to affect different folks, but young people, teenagers, young adults especially, they start using those drinks to get powered up, and wouldn't you know it, if there's a proclivity towards anxiety, it's going to speed up that kicking in of the anxiety. Or if there's already anxiety, it's going to kind of make it worse, and they may not realize it because they're jumping into things, doing it fast and furious, not realizing it's anxiousness really that's causing them to do that. Substance abuse, we don't need to say much about that risk. It's obvious. Medications, certain medications can be a risk factor for anxiety, which is why it's so important to talk with your doctor, even if you get supplements, herbal supplements, in helping speak with your doctor to make sure that you're taking the right ones, or those that are not going to aggravate the anxiety or panic attack or agoraphobia. But herbal supplements, there are those that help, and that's important to know what they are. Your physical health is always important to take care of yourself. See your doctor first. Eliminate anything physical that could be bringing on that anxiousness. When dealing with all these things combined, sometimes it just really, the warning sign, the alarm, is when you see signs that kind of come together as threatening and dangerous. And it may not just be for anxiety, it could be up for other things as well. And so there's a rule of thumb of looking at all these things and kind of wrapping them together. So it can be tough and troubling before you've grown up or before you're maturing or during your, especially your young adulthood, where there's so many new things occurring. You're out there in the workforce, you're trying to begin to make a career for yourself, and that stress causes you to react. And as you're reacting, you start overreacting. And in the overreacting, things like worry and anxiousness intensify. There's frequent tantrums that can occur. When you start to notice you're getting easily agitated, you're snapping at people, or people are saying, well, what's wrong with you? You know, you never used to be this way. Well, that's a warning sign, something's going on. You're getting frequent stomach aches, or you're getting frequent headaches. Certainly migraines can be coming from something else, but if those things are happening a lot, it can be a combination of things. Constant motion. If you notice, you're just, I gotta keep going, I can't sit quietly. Trouble sleeping night after night, losing interest in things that were once pleasurable for you, avoiding spending time with certain friends or any friends because there's anxiousness or there's discomfort or there's something that's causing you to ramp up the avoidance behavior. Trouble doing your work, whether it's at work or school, grades decline, work performance declines. Maybe there's an exaggerated fear occurring of gaining weight or losing weight. Perhaps you're overdoing it with exercising, and somebody mentions, "Hey, you know, you're really overdoing it. You need to settle back, skip a day or skip this or that, because you're it's not good for your muscles." And if you notice you're over dieting, okay, that might be okay for a little while. But if it's ongoing, something could be going on there. That's a warning sign. Low energy, no energy, normal for us older folks. In some cases, I have too much energy because I think, well, I got all these things I got to do, but then I pay for it, and I've got to stop and rest. If you start noticing that you're doing things that are harmful for you, that are not wise. Speeding, reckless driving. A lot of times when dealing with depression, that's one of the questions we ask. Have you been having issues with reckless driving? Because reckless driving can be considered passive suicide. And so we look into that to make sure, hey, none of that's going on. But if you're noticing those kinds of things are happening, or you're doing things that are destructive, sabotaging yourself, where you didn't used to do that, well, those are warning signs. Smoking cigarettes, that's certainly a warning sign. It's a drug. It's going to affect you over time. Anything you take into the body in excess can be a warning sign. Pay attention to it. Thoughts of suicide, that's obvious. And if you feel that your behavior is being controlled, your brain is being controlled, whether from the outside or even from the inside, or you hear voices, Okay, big warning signs. All these warning signs are there to tell us we need to pay attention. Something serious can be going on. So how do we treat all this? How do we treat anxiety, panic disorder, agoraphobia, social phobias, or any of these other warning signs that I mentioned? Well, there is treatment for all of it. We have to get over our pride or our fear of embarrassment and talk about it with those who know about it. Not just a close friend, but with a professional, a person of authority that you identify with and trust, the pastor in your church, the youth pastor, the counselor, Christian counselor, the mental health counselor, social worker, psychologist, psychiatrist, your medical doctor, your primary care physician. Counseling or psychotherapy helps. And it can be quick, it can take time, depends on the situation and how long it's been going on. And oftentimes, as I mentioned earlier, cognitive behavioral therapy is used. From our perspective as Christian counselors, we use a biblical model in which, as I mentioned, it's right or wrong thinking. And in that right or wrong thinking, we're identifying the problems, the sources, and looking at it from a perspective of, gosh, is that faulty belief? Is that really true? If it's not true, then what do I need to say to myself? That self-talk. What do I need to say to myself to help me to dispute that, but also to replace it? If you fight against a thought, it's going to get stronger. You're kicking in the fight or flight response. It's already sensitive. For anxiety, the limbic system is already oversensitive. And when you add to that oversensitivity another threat by telling it it can't do something, what's it going to do? It's going to want to do it. So it's going to want to think more about it. Have to replace it. From a Christian counseling perspective, the blood of Christ covers us, cleanses us, washes over, replaces our sins with pureness, with goodness, with holiness, with good thoughts that we're able to have, that we work towards having. So the Bible tells us, think on those things that are good and pure and holy. Think on those thoughts that are good thoughts. And if you do that, the brain secretes an enzyme that builds a fertilizer type protein that feeds brain cells, decreases the power of the fight or flight response in the limbic system of the brain, especially the amygdala. It quiets it down because you're not feeding it anymore with those bad thoughts. And the love and peace center of the brain is growing stronger, actually will enlarge in SPECT scans or PET scans as they look at them, or MRIs, they'll see them enlarge over time because you're feeding it more with the good thoughts. Herbal supplements can help, medications can help, support groups. Well, that means you got to take the risk of being in front of people. If you can handle that, that's great. Please do it, because that helps a lot to hear from others what's going on with their anxiety, how they worked with it, how they got help, whatever may have helped them, or whatever they haven't been able to fix. Suddenly, oh yeah, I had that problem and I've worked on it. Now you're helping someone else. And when you're helping someone else, here again comes those good thoughts. You're producing the enzyme, producing the good protein, causing your brain to thrive. All these things are helpful in the treatment. So it's never just one thing. It's a group of things. Look into that group of things in treating your anxiety or recommending it to someone you know that may have anxiety, encouraging them and supporting them in getting through all of this. Well, I hope this was helpful for you today. God bless, and we'll see you again.